Hey guys, this is Dr. Jeff Ullery at Whole Body Health, and I wanted to go over an exercise that I recommend very frequently. It's a really powerful exercise to stabilize the low back, especially if you've got this one particular thing going on in that low back that is causing pain and pressure. And so there's a situation where you can have the lowest vertebra in the back, would be L5, sitting on top of the tailbone. These are my simulated spine. And so this would be L5, this would be the tailbone. Sometimes what can happen is that L5, that lowest vertebra, can move forward slightly, even just slightly on top of the tailbone. And when it does that, it creates a ton of discomfort and pressure, and sometimes some pretty significant pain, with pain going down both the legs, both sides of the front of the legs. One of the things that it causes when you've got that scenario going on is it'll create just tremendous amounts of tension in the hip flexors and the glutes and the hamstrings and in the low back. And the problem with that is there's no amount of stretching that can actually correct that. You have to actually correct that subluxation or that dysfunctional movement in that part of the spine. And the problem with that is in the back part of the spine there's some joints called facet joints. And when that vertebrae moves forward, it creates just a ton of pressure in those joints, which has a lot of nerves in that joint, and it just creates a lot of problems and pressure. So what I want to do is show you how to identify whether or not this is a problem that you may be dealing with if you have if you're having back pain. And then secondly, I want to show you how to correct it. And it's just a real simple way to adjust yourself. One of the few ways that I recommend people adjust themselves. But it's a way to adjust your own back and get almost immediate relief from this. So one of the ways that you know that, or that you might consider this, is when, like I've talked about on my former sitting videos, is when we sit in a position where we're unsupported. A lot of times what will happen is we end up slouching, we end up sitting like this. And so it's very common to sit like this, especially if we're going to use an ottoman or something where we have, or a recliner where we have our legs up. It's very common to sit like this, especially if you're sitting in your bed or on the couch working at the computer in your lab, etc. And so when we sit like this, what we're doing is we're actually tucking that tailbone underneath, and instead of sitting on the sits bones, we begin sitting on the tailbone. And when we sit on the tailbone, it immediately shuts off your pelvic floor or your deep core muscles. Kegel muscles would be another way to call those, another name to call those. And so when we lose that stability in the pelvic floor, which is that lower diaphragm holding us together, the pelvic floor and the pelvis is a foundation of the entire spine. And once we lose that stability in the foundation, everything above it begins to deteriorate in the way that it functions. It doesn't work like it's supposed to. So the hip flexors get extremely tight, the glutes can get extremely tight, the back muscles can get extremely tight. And so first of all, we have to correct that sitting. We'll put a link for our sitting video down at the bottom in our transcript. And the way we want to sit is we want to sit supported. If you want to sit, you want to move forward and sit more on the sits bones, but you can get more of that on that video that we talked about. Let's go ahead and talk about how to do this exercise. So one of the things that you can do to determine whether or not this issue is a problem, which we call that an anterior L5 vertebra. Go ahead and stand up for me, Jude. Is if you put your hands right here on your back and then just do a back extension. Keep your head neutral, but do a back extension. When you do that back extension, if you feel just a lot of pressure or pain, more of a dull, achy type of pain in this area when you do that, or if you get an exacerbation of pain going down the legs, or any kind of exacerbation of that low back pain when you do that move, you know that you need to do this exercise to actually take the pressure off that low back. So let's go ahead and have you lay on your back. All right, and so there's a number of different things. The key thing we want to do is we want to use a block under the tailbone. And so the way I do that is I take a yoga block, and I cut 1/3 of that yoga block off, and then we'll use that part to put under the tailbone. I have one already cut. just like in all of the videos where they cook and make things. It's already made for us. So we're going to use this to put under the tailbone, and then we'll use this to put between Judy's knees. And so we want something between the knees because we want to activate the muscles, the adductor muscles. Those are the muscles on the inside of the legs. Those are only usually activated if you ski or skate, or if you go to the gym and do that really crazy clamshell exercise that I think is ridiculous. That's just my personal opinion. And so we want to take the skinny side of this block and we want to put it under the tailbone. When we put it under the tailbone, we want to make sure that it's below the belt line. Can you see that, Bryce?
Mm-hmm.
So we want to put it below the belt line. If you put it too high, it's not going to work. What we're trying to do is we're trying to brace the tailbone and give room for that lowest vertebra to move backwards towards the table. Okay? And so Judy, can you lift your hips? And when we lift the hips, I'm gonna put this under her tailbone, right in the middle. Go ahead and bring your hips down. So it's between the two joints. Does it feel like it's in the middle?
Mm-hmm.
Okay, so we want it right in the middle. We want it just below the belt line. And then what I'm gonna have Judy do is I want her to engage a very specific set of muscles. The muscles we want to stay away from are the abdominals and the hamstrings back here and the hip flexors. Okay, if you feel like you're grabbing in your hip flexors, your abdominals, or your hamstrings, then we're doing it incorrectly. And so the muscles that we want to make sure that we engage, and you have to try to do two of them, and one of them just happens automatically. The one that works automatically is your quads are automatically going to fire, right? In addition, what we want to do is make sure we engage the pelvic floor. Okay, so those are those muscles that are deep in the pelvis. That if you have to go to the bathroom, if you have to pee, you have to hold it. Those are the hold it muscles. And then the last one is the glute muscles, the butt muscles. So I always tell people, buns of steel. So you want to squeeze the glutes. You want to squeeze that pelvic floor like you need to pee. And then what you want to do, Judy, is you want to rock your hips when I ask you to. You rock your hips back. So that means your pubic bone and your tailbone are going to go towards the ceiling, and your belly button should go towards the table. Okay? And so let's go ahead, and I'm going to actually position, Bryce, I'm going to position her feet a little bit further out first. Okay? So go ahead and engage in that glute and in the pelvic floor, and then rock it back. Do you feel how much hamstring is involved in that?
Mm-hmm.
So we want to go ahead and stop. If you feel like there's a lot of hamstring, one of two things will happen is, one, you'll cramp up. Okay?
Mm-hmm.
Or two, you just won't get the benefit that you're looking for from this. And so if you feel a lot of engagement in the hamstrings, what we want to do is we want to move the feet, the heels closer to the bottom. All right, and now let's go ahead and do the same thing. So engage here first, and then rock your hips. Yeah, that's perfect. Okay, and you're going to hold each one of these for 10 seconds. And you're going to do 10 of them. And so when you do this, when you rock your hips back, that tailbone is actually rocking forward, and that L5 is rocking back towards the ground. And you're actually doing an adjustment of yourself. Not only that, by engaging the glutes and the pelvic floor and the quads, it's actually turning down the volume on the hip flexors and the hamstrings, which is really, really beneficial in this scenario. So we want to make sure we do that, and then you go ahead and relax it for a 10 count. So go ahead and relax for a second. And then we want to repeat the exercise 10 times. If this is something that's really problematic for you, then you actually need to perform this exercise. The most benefit would be at the end of the day after you've been sitting all day, okay? Especially if you've been sitting poorly, which if you're sitting a lot, it's very likely that you're sitting poorly, right? And you could do 2 sets of this at the end of the day, or any time that it's bothering you, you could actually do this. Anytime you've been doing a lot of yard work, where you've been squatting a lot, anytime where you've been putting a lot of pressure on that pelvis and low back, and this is just a great way to do this exercise. So go ahead and repeat that one more time, Judy. Judy's doing it perfectly. So she's engaging the glutes, she's engaging the pelvic floor, her belly's going, it's actually hollowing out. Sometimes if you're engaging the abs, they'll poof out towards the ceiling. We don't want that. Guys do that a lot. Okay, women usually get this really fast. We have a hard time getting it for some reason. We try to explode like it's a big squat of about 400 pounds, but it's really not. We're just trying to do a finesse move. So again, you repeat this. One of the things you can do with this is you can actually add components as well. You can take a pillow or a towel or something like that and put it under the neck. If you look at Judy's neck, she's actually really flat right now in her neck, so I really like to combine activities like I've taught before, and I would put this rolled up towel behind her neck and actually have her work on that neck curve while she's working on the low back. And so remember that if you decide to do this, you want to make sure that curve is big enough to where it feels like there's a lifting effect in the neck, but it's not so big, that towel's not so big that you're hanging in the air. You want to put it nice and low against the shoulders. If your head's hanging in the air, then you're doing it incorrectly. So anyways, this is the exercise that I really like to give to stabilize that low back. Almost always when you get up and recheck this thing, the low back will feel better. In addition, it works if you follow this exercise with hip flexor stretches, like we've shown you before on our hip flexor stretch video, your hip flexors will loosen up significantly better. So thanks for joining us, and look forward to seeing you soon.